Hi everyone, my name is Whitney and I'm a registered dental hygienist here to answer a question I've seen all over social media. Do you still need to use a lead apron during dental x-rays? So the American Dental Association now says no, but there's a catch. It depends on where you live. So here's the deal. The ADA updated its guidance in February 2024. They reviewed tons of research on radiation exposure and found modern dental x-rays already give extremely low radiation doses. Lead aprons and thyroid collars don't actually protect against internal scatter, which is the main source of radiation exposure inside your body. And in fact, blocking the beam with a shield can sometimes make things worse. If it causes retakes, you end up with more exposure. You know, like when the apron gets caught in the way and causes a white spot. Anyway, overall, evidence shows that limiting the beam size to only the area you need, proper positioning, and using digital radiography is far more effective than a lead apron. However, here's the important part. The ADA's guidance is a recommendation, not a law. Some states still legally require shielding because they haven't caught up with the new recommendations, the new guidelines yet. Whereas other states leave it up to the dental office. Some states it's optional, your choice, and there's a few states that may even prohibit it. Will tell you to not use the lead apron at all. So before you toss your apron or make it optional, you must check your state's regulations. I will link the ADHA's page on finding your state's Dental Practice Act, which is helpful when trying to find your state's dental laws. You can also always Google who governs dental hygienists in, insert your state, and you'll find your regulatory board who should tell you if shielding is required or not. I would love to do this all for you for all 50 states and make a list, but I would hate for every time a state updates their laws for me to not get the memo and the list becomes incorrect. So it's very important for you to check your own state laws regularly. And don't worry, if your patient wants the lead apron and your state says you don't have to anymore, it's your choice, you can still use it. It's not harmful. It's just not necessary for protection in most cases. In conclusion, modern dental x-rays are safe. We already knew this. Modern digital x-rays are like 80 to 90% less radiation than the old school film x-rays. So lead aprons are not required in most situations. But not every state has caught up with this new recommendation yet. So always follow your state's current laws and explain changes to your patients so they understand why you're doing things differently. I hope this cleared up some of that confusion. Be sure to like, subscribe, and turn on your notifications if it did. And if you want even more teeth talk, you can visit my website, teethtalkgirl.com, and hang out with me on Instagram at teethtalkgirl. Peace, love, and teeth.